Memory infants make robust advances in both recognition memory and recall memory during their first year. In recognition memory, the infant is able to recognize a particular object he has seen a short time earlier, and hence will look at a new object rather than the older one, if both are present side by side. Although newborns cannot remember objects seen more than a minute or two previously, their memory improves fairly rapidly over the first 4 or 5 months of life. By 1 month they are capable of remembering an object they saw 24 hours earlier, and by 1 year they can recognize an object they saw several days earlier. 3-month-old infants can remember an instrumental response, such as kicking the foot, to produce a swinging motion in a toy that they learned 2 weeks earlier, but they respond more readily if their memory is strengthened by repeated performances of the action. By contrast, recall memory involves remembering, retrieving the representation, or mental image, an event or object that is not currently present. A major advance in recall memory occurs between the 8th and 12th months and underlies the child's acquisition of what Piaget called the idea of the permanent object. This advance becomes apparent when an infant watches an adult hide an object under a cloth and must wait a short period of time before being allowed to reach for it. A 6-month-old will not reach under the cloth for the hidden object, presumably because he has forgotten that the object was placed there. A 1-year-old, however, will reach for the object even after a 30-second delay period, presumably because he is able to remember its being hidden in the first place. These improvements in recall memory arise from the maturation of circuits linking various parts of the brain together. The improvements enabled the infant to relate an event in his environment to a similar event in the past. As a result, he begins to anticipate his mother's positive reaction when the two are in close face-to-face interaction, and he behaves as if inviting her to respond. The infant may also develop new fears, such as those of objects, people, or situations with which he is unfamiliar, i.e., which he cannot relate to past experiences using recall memory. Piaget's observations. As stated previously, Piaget identified the first phase of mental development as the sensorimeter stage, birth to 2 years. This stage is marked by the child's acquisition of various sensorimeter schemes, which may be defined as mental representations of motor actions that are used to obtain a goal. Such actions include sucking, grasping, banging, kicking, and throwing. The sensorimeter stage, in turn, was differentiated by Piaget into 6 subphases, the first 4 of which are achieved during the initial year. During the first subphase, which lasts 1 month, the newborn's automatic reflexes become more efficient. In the second subphase, the infant's reflex movements become more coordinated, though they still consist largely of simple acts, called primary circular actions, that are repeated for their own sake, e.g., sucking, opening and closing the fists, and fingering a blanket, and do not reflect any conscious intent or purpose on the infant's part. During the third phase, lasting from the 4th to the 8th month, the infant begins to repeat actions that produce interesting effects. For example, he may kick his legs to produce a swinging motion in a toy. In the 4th subphase, from the 8th to the 12th month, the child begins coordinating his actions to attain an external goal. He thus begins solving simple problems, building on actions he has mastered previously. For example, he may purposely knock down a pillow to obtain a toy hidden behind it. During the 5th subphase, covering the 12th to 18th months, The child begins to invent new sensorimeter schemes in a form of trial and error experimentation. He may change his actions toward the same object or try out new ones to achieve a particular goal. For example, if he finds that his arm alone is not long enough, he may use a stick to retrieve a ball that rolled beneath a couch. In the final subphase of infancy, which is achieved by about the 18th month, the child starts trying to solve problems by mentally imagining certain events and outcomes, rather than by simple physical trial and error. Experimentation. The child's actions thus far have shown progressively greater intentionality, and he has developed a primitive form of representation, which Piaget defined as a kind of mental imagery that can be used to solve a problem or attain a goal for which the child has no habitual available action. An important part of the child's progress in his first year is his acquisition of what Piaget calls the idea of object permanence, i.e., the ability to treat objects as permanent entities. According to Piaget, the infant gradually learns that objects continue to exist even when they are no longer in view. Children younger than 6 months do not behave as if objects that are moved out of sight continue to exist. They may grab for objects they see, but lose all interest once the objects are withdrawn from sight. However, infants of 9 months or older do reach for objects hidden from view if they have watched them being hidden. Children aged 12 to 18 months may even search for objects that they have not themselves witnessed being hidden, indicating that they are capable of inferring those objects' location. Show such a child a toy placed in a box, put both under a cover, and then remove the box. The child will search under the cover, as though he inferred the location of the toy. Vocalizations. The first of the 2 basic sounds made by infants includes all those related to crying. These are present even at birth. A second category, described as cooing, emerges at about 8 weeks and includes sounds that progress to babbling and ultimately become part of meaningful speech. Almost all children make babbling sounds during infancy, and no relationship has been established between the amount of babbling during the first 6 months and the amount or quality of speech produced by a child at age 2. Vocalization in the young infant often accompanies motor activity and usually occurs when the child appears excited by something he sees or hears. Environmental influences ordinarily do not begin to influence vocalization seriously before 2 months of age. In fact, during the first 2 months of postnatal life, the vocalizations of deaf children born to deaf parents are indistinguishable from those of infants born to hearing parents. Environmental effects on the variety and frequency of the infant's sounds become more evident after roughly 8 weeks of age. The use of meaningful words differs from simple babbling in that speech primarily helps to obtain goals. Physical growth and development. A child's first year is characterized by rapid growth of body and brain. Healthy, well-nourished children experience an almost 200% increase in height between birth and 1 year. Every normal healthy infant proceeds through a sequence of motor development that occurs spontaneously and requires no special training. The infant can reach for and grasp an object by about the 4th month and can grasp a small object between his thumb and forefinger by the 10th month. By 4 months of age, most babies are able to sit up for a minute or so with support, and by 9 months they can do so without support for 10 minutes or more. Most babies begin crawling, i.e., moving with one's abdomen in contact with the floor, between 7 and 10 months, and are creeping on hands and knees adequately at the end of that time. By 10 months an infant can pull himself up to a standing position by holding onto an external support, e.g., a piece of furniture, and by 12 months he can stand up alone. He is able to walk with help by 12 months and can walk unaided by 14 months. By 18 months, with exposure to stairs, the average child can walk up and down them without help, and by his second birthday he can run, walk backward, and pick up an object from the floor without falling down. Emotional development. Emotions are distinct feelings or qualities of consciousness, such as joy or sadness, that reflect the personal significance of emotion-arousing events. The major types of emotions include fear, sadness, anger, surprise, excitement, guilt, shame, disgust, interest, and happiness. These emotions develop in an orderly sequence over the course of infancy and childhood. Even during the first 3 or 4 months of life, infants display behavioral reactions suggestive of emotional states. These reactions are indicated by changes in facial expression, motor activity, and heart rate, and of course by smiling and crying. Infants show a quieting of motor activity and a decrease in heart rate in response to an unexpected event, a combination that implies the emotion of surprise. A second behavioral profile, expressed by increased movement, closing of the eyes, an increase in heart rate, and crying, usually arises in response to hunger or discomfort and is a distress response to physical privation. A third set of reactions includes decreased muscle tone and closing of the eyes after feeding, which may be termed relaxation. A fourth pattern, characterized by increased movement of the arms and legs, smiling, and excited babbling, occurs in response to moderately familiar events or social interaction, and may be termed excitement. In the period from 4 to 10 months, new emotional states appear. The crying and resistance infants display at the withdrawal of a favorite toy or at the interruption of an interesting activity can be termed anger. 1-year-old infants are capable of displaying sadness in response to the prolonged absence of a parent. Finally, infants begin displaying signs of the emotion of fear by their 4th to 6th month. A fearful response to novelty, i.e., to events that are moderately discrepant from the infant's knowledge, can be observed as early as 4 months. If an infant at that age hears a voice speaking sentences, but there is no face present, he may show a fearful facial expression and begin to cry. By 7 to 10 months of age, an infant may cry when approached by an unfamiliar person, a phenomenon called stranger anxiety. A month or 2 later, the infant may cry when his mother leaves him in an unfamiliar place. This phenomenon is called separation anxiety. It is no accident that both stranger and separation anxiety first appear about the time the child becomes able to recall past events. If an infant is unable to remember that his mother had been present after she leaves the room, he will experience no feeling of unfamiliarity when she is gone. However, if he is able to recall the mother's prior presence and cannot understand why she is no longer with him, that discrepancy can lead to anxiety. Thus, the appearance of stranger and separation anxiety are dependent on the improvement in memorial ability. These emotions in young infants may not be identical to similar emotional states that occur in older children or adolescents who experience complex cognitions in concert with emotion. These are missing in the young infant. The older child's anger, for example, can remain strong for a longer period of time because the child can think about the target of his anger. Thus, it may be an error to attribute to the young infant the same emotional states that one can assume are present in older children. Attachment, perhaps the central accomplishment in personality development during the first years of life, is the establishment of specific and enduring emotional bonds, or attachment. The person to whom an infant becomes emotionally attached is termed the target of attachment. Targets of attachment are usually those persons who respond most consistently, predictably, and appropriately to the baby's signals, primarily the mother, but also the father and eventually others. Infants are biologically predisposed to form attachments with adults, and these attachments in turn form the basis for healthy emotional and social development throughout childhood. Infants depend on their targets of attachment not only for food, water, warmth, and relief from pain or discomfort, but also for such emotional qualities as soothing and placating, play, consolation, and information about the world around them. Moreover, it is through the reciprocal interactions between child and parent that infants learn that their behavior can affect the behavior of others in consistent and predictable ways, and that others can be counted on to respond when signaled. Infants who do not have a particular adult devoted to their care often do not become strongly attached to any one adult and are less socially responsive, less likely to smile, vocalize, laugh, or approach adults. Such behavior has been observed in children raised in relatively impersonal institutional surroundings and is shared by monkeys reared in isolation. The social smiling of 2-month-old infants invites adults to interact with them. All normal human infants show a social smile, which is, in fact, their first true sign of social responsiveness. The social smile is apparently innate in the human species. At about 6 months of age, infants begin to respond socially to particular people who become the targets of attachment. Although all infants develop some form of attachment to their caregivers, the strength and quality of that attachment depends partly on the parent's behavior to the child. The sheer amount of time spent with a child counts for less than the quality of the adult-child interaction in this regard. The parent's satisfaction of the infant's physical needs is an important factor in their interaction, but sensitivity to the child's needs and wishes, along with the provision of emotional warmth, supportiveness, and gentleness, are equally important. Interestingly, mothers and fathers have been observed to behave differently with their infants and young children. Mothers hold, comfort, and calm their babies in predictable and rhythmic ways, whereas fathers play and excite in unpredictable and less rhythmic ways. One significant difference has been detected in the quality of infants' attachment to their caregivers, that between infants who are securely attached and those who are insecurely attached. Infants with a secure attachment to a parent are less afraid of challenge and unfamiliarity than are those with an insecure attachment. During the first 2 years of life, the presence of targets of attachment tends to mute infants' feelings of fear in unfamiliar situations. A 1-year-old in an unfamiliar room is much less likely to cry if his mother is present than if she is not. A 1-year-old is also much less likely to cry at an unexpected sound or an unfamiliar object if his mother is nearby. Monkeys, too, show less fear of the unfamiliar when they are with their mothers. This behavioral fact has been used to develop a series of experimental situations thought to be useful in distinguishing securely from insecurely attached infants. These procedures consist of exposing a 1-year-old to what is known as the strange situation. Two episodes that are part of a longer series in this procedure involve leaving the infant with a stranger and leaving the infant alone in an unfamiliar room. Children who show only moderate distress when the mother leaves, seek her upon her return, and are easily comforted by her are assumed to be securely attached. Children who do not become upset when the mother leaves, play contentedly while she is gone, and seem to ignore her when she returns, are termed insecurely attached avoidant. Finally, children who become extremely upset when the mother leaves, resist her soothing when she returns, and are difficult to calm down are termed insecurely attached resistant. About 65% of all American children tested are classed as securely attached, 21% as insecurely attached avoidant, and 14% as insecurely attached resistant. All other things being equal, it is believed that those children who demonstrate a secure attachment during the first 2 years of life are likely to remain more emotionally secure and be more socially outgoing later in childhood than those who are insecurely attached. But insecurely attached resistant children are more likely to display social or emotional problems later in childhood. The development of a secure or insecure attachment is partly a function of the predictability and emotional sensitivity of an infant's caregiver, and partly the product of the infant's innate temperament, rather than simply reflecting excitement.